Imagine a federal health report on children's diseases filled with citations that don't even exist. That's exactly what Congressman Raul Ruiz exposed when he went after RFK Jr., accusing him of misleading the public with false references. In this heated exchange, Ruiz doesn't hold back. He calls it dishonest, dangerous, and a betrayal of public trust. Let's break down why this moment matters and what it reveals about leadership and accountability.
Thank you, Mr. Chairman. Earlier, Secretary Kennedy, you said you wanted to instill trust using truth, evidence-based, gold standard, science. But Mr. Kennedy, in late May, the so-called, quote, Presidential Commission to Make America Healthy Again released what HHS described as a, quote, groundbreaking assessment that purported to identify the key drivers behind childhood chronic disease. Improving the health of America's children is a goal I share, and I recognize this is a passion of yours, Mr. Secretary. That is why I was struck to learn that the report was riddled with mistakes, misconstruing and intentionally or not misstating key references, data, and evidence that either do not exist or are not accurately reflected in the report. When journalists reached out to many of the authors of the studies included in the MAHA assessment, numerous researchers and academics stated that they never wrote the papers as cited, or the papers cited didn't even exist altogether. Mr. Chairman, I want to submit these 3 news reports on these miscited documents from notice from May 29th and May 30th.
Without objection.
Ms. Secretary Kennedy, you're listed as the chair of the commission. Did you read the report and fact-check its sources prior to publication?
All of the factual
Did you read the reports, and did you yourself fact-check them, sir?
I did not fact-check.
You did not fact-check. So why then, as has
all
been widely reported, excuse me, sir, I'm speaking. Why then did the report include citations to sources that don't even exist? How does that happen under your leadership, sir?
All of the foundational assertions in that report are accurate.
They did not exist. How can they be accurate if they did not exist, sir?
Some of the citations
You know, in fact, my understanding is that even once the report was updated, more authors and researchers came forward stating that their research was misconstrued. This is quite unbelievable, sir. In fact, I was a pre-med at UCLA. They have a great pre-med program. If somebody turned this in as an undergrad to their professor at UCLA, they would have received an F, sir, an F for the misinterpretation, the falsehoods, the denials, and also citing references that don't even exist. That's lying and dishonest, sir. My concern here is that you and this administration are undertaking vast changes to our federal public health system and using purported facts and gold standard evidence that you claim to have as justifications for your decisions, actions, and frankly, your decimation of our nation's public health infrastructure. Yet, what you are relying upon isn't real. It isn't data-driven. And it isn't based in fact, science, or reality, sir. It's wrong. As the secretary of one of the most consequential departments within our federal government, mischaracterizing data is not just some typos in a report that gets put on a shelf. Instead, your words and your words of your department carry significant weight. Do you agree?
The citations in that report were wrong. That was a mistake. They were corrected within 24 hours.
Yeah, but they were wrong still even after that, and they're wrong still today.
There were no
So do you believe that your words carry significant weight?
There were no erroneous.
Do you believe your words carry significant weight?
There were no erroneous factual assertions.
Do you believe that the Secretary of the Department of Health and Human Services plays an important role in upholding scientific integrity?
Yes.
Okay, so then, in fact, what is most striking about this is that you've also threatened to bar governmental scientists and researchers from publishing in top medical journals. You've barred them from publishing in top reputable medical journals and instead proposed, quote, creating our own journals in-house. The idea that we would limit the ability for federal researchers to publish in the most preeminent medical journals and instead have HHS just publish more reports like their MAHA failed assessment, lacking the scientific rigor, accuracy, or peer-reviewed criteria that are required by leading journals, should worry us all for the future of medicine and innovation. Sir, you mentioned that building trust was a priority number 7. You have failed already in building that trust. How can we trust you when in your report, under your leadership, when you're the chair of this report, has false information and makes up research that didn't even exist? So, Chairman,
you left me
I
no time
yield
to answer
back
your question.
the remainder of my time.
Gentleman yields. The chair now recognizes.
What Congressman Raul Ruiz did in this exchange with RFK Jr. wasn't just a heated back and forth. It was a moment that spotlighted one of the most fundamental issues in public leadership: credibility. Ruiz called out the Make America Healthy Again report, a document that was supposed to identify the root causes of childhood chronic disease. On paper, this should have been a groundbreaking, evidence-driven blueprint for improving children's health across the nation. But when journalists and researchers dug deeper, they discovered a troubling reality. Many of the report's citations didn't exist, and some of the research was either misquoted or distorted. That's where the problem becomes so much bigger than just typos or technical errors. When the federal government puts out a report, especially one tied to children's health, people expect precision, accuracy, and trustworthiness. These aren't abstract academic issues. They impact real lives. Parents, doctors, educators, and policymakers make decisions based on these reports. If the evidence is shaky or fabricated, those decisions can go terribly wrong, leaving families vulnerable and undermining public confidence. Ruiz's comparison to a UCLA undergrad getting an F for such work wasn't meant as a jab. It was a reminder that if young students are held to rigorous academic standards, leaders at the highest levels of government must be held to even greater accountability. Because unlike a failing grade in college, mistakes at this level can shape national policy, redirect funding, and influence how millions of Americans view health and science. And what made this moment even more unsettling was RFK Jr.'s response. Instead of directly addressing why false references appeared in the report, he doubled down, insisting that the foundational assertions were correct. But here's the reality. In science, assertions without reliable evidence don't mean much. Science is built on verifiable data, transparent methods, and peer review, not on gut feelings or broad claims. If that foundation is compromised, then the entire structure collapses. Even more concerning is the idea Ruiz raised, that under this leadership, federal scientists have been discouraged from publishing in respected, peer-reviewed medical journals, with proposals instead to build in-house outlets. On the surface, that might sound like efficiency, but in reality, it's dangerous. Why? Because peer review isn't just academic gatekeeping, it's a safeguard. It ensures that findings are tested, challenged, and validated before being presented as truth. Remove that layer of scrutiny, and what you're left with is unchecked, unverified, and potentially misleading information presented as fact. That erodes scientific integrity and public trust simultaneously. And trust is really the key word here. Trust in science, trust in institutions, trust in leadership. Without it, even the best public health initiatives can crumble. We saw this during the pandemic. When trust was fragile, misinformation spread faster than the virus itself. If government agencies publish reports riddled with errors, it gives ammunition to those already skeptical of science and institutions, deepening polarization and confusion. So when Ruiz told RFK Jr. that this was lying and dishonest, it was more than political rhetoric. It was a statement about the stakes of scientific integrity and governance. Because when leaders misrepresent or distort data, intentionally or not, the public pays the price. And in this case, the public includes some of the most vulnerable among us: children suffering from chronic diseases, families struggling with medical costs, and communities already facing health inequities. This exchange wasn't just about calling out sloppy work. It was about holding power accountable, ensuring that when leaders say they're working to make America healthy again, their actions, words, and evidence truly reflect that mission. Because without truth at the core, no health system, no matter how ambitious, can succeed. And that's why oversight like this matters. If you want leaders to be held to the highest standard of integrity, especially when it comes to something as important as public health, then it's critical to stay informed and engaged. If you found this breakdown valuable, hit the like button, share it with others who care about accountability, and subscribe for more in-depth analysis of the moments that define our future.